Hi everybody, Jim Crawford with Better Homes and Gardens Real Estate. I'm here with Dr. Ciera Conkle of Conkle Chiropractic. How are you?
I'm good. How are you doing?
Fine, thank you. Fine, thank you. So, how long have you been in the business and how'd you get started?
So I've been in the business now for about 6 months.
Congratulations.
Thanks. I got out of school end of July end of 2019, and since then I decided to open up my own practice and get started here in Pottstown.
That's great. That's great. So tell me about some of your offers and services, what you do.
What I do. So as a chiropractor, the major thing that we do is adjustments for sure. I adjust every single patient that comes through the door, whether it be using a device or whether it be me doing an actual manual adjustment on them. Every single person who comes through the door, they get an adjustment. I also do a lot of soft tissue work on my patients.
Okay.
That's something that some chiropractors tend to do more of and some tend to do less of. But for me, I think that that's so important because people's muscles tend to be tight. And if I don't address that part of the complaint, then I'm not getting the whole picture.
Right.
You need to address the muscles and the joints in order to get a good lasting adjustment.
That's great. Excellent. So who's the perfect candidate to come see you?
I love that because I literally feel like everybody is.
Okay.
It's pretty much no matter who somebody is, there's always a chance that they need an adjustment.
Sure.
Even if somebody doesn't have pain, it's great for preventative care too. I mean, of course, most people that come to me, they come to me with pain.
Right.
You know, they
Right.
come with me, they say my low back hurts, they say my neck hurts, and those are great candidates. I adjust young kids. So if you think about kids' lives, they are pretty traumatic. How often do you see little kids fall?
Pretty regularly. I have 2 of them at home.
Exactly. So while they may not have pain, they are inflicting trauma on their bodies almost daily.
Sure.
And so an adjustment can help them too. If nothing else, prevent pain from happening in the future.
Sure. Preventative instead of proactive instead of reactive.
Exactly.
Right.
Exactly. And I mean, I do both. I
Sure.
do proactive care and I do reactive care.
That's great. That's good to know. I would not have thought of that. So that's really good to know. What's something that people might not know about the chiropractic profession?
I mean, there are many different ways that people treat in the chiropractic profession. None of us are all the same. Like there's if you go to one chiropractor, they're not going to do the same thing as another chiropractor. That being said, a lot of us have many different things in our toolbox. So just because somebody thinks that they can only get adjusted one way, if they're afraid of being adjusted manually, because I know a lot of people, they tell me beforehand that they are afraid of a neck adjustment.
Mm.
But I have other tools in my toolbox. I don't have to adjust them that way. I have a little tool which I often tell people is called the clicker tool. It's really called an activator, and it's a very gentle way of adjusting. So if somebody is afraid of the manual way of adjusting, there are other ways that we can adjust.
That's great. Absolutely. Can you think of a memorable experience with a past patient or just in general?
I can't necessarily go into detail with that.
Sure.
But I feel like all of my patients are memorable. And I love getting to know each person personally and seeing how they progress through care. I've seen plenty of people who come in and they've had pain for years and years and years and years, and they think that they have to live with that. And some of my favorite experiences have been people then telling me over time, they're like, whoa, I thought I was gonna have to live with that for the rest of my life. And then all of a sudden they're like, I don't have that pain anymore. And I realize now I don't have to deal with that. Some of my other great experiences are when I am adjusting young kids. I have kids who come into the office with their parents now, and once their parents are done, they ask me to be adjusted.
That's great.
And I think I think it's awesome because it's them becoming comfortable with me and realizing that their bodies do actually need to be taken care of.
Sure. Yeah, that's fantastic. Well, I really appreciate you spending some time with me. All the links will be posted at the bottom of the page. Go visit Dr. Ciera at Conkle Chiropractic. And if you want to hear more from me, you can visit www.jimcrawfordrealestate.com. Thank you very much, and we'll see you next time.
See ya!